Hey guys, thank you so much to all of our panelists for joining us today. Welcome to Healthcare in Innovation in Action. From using AI to discovering new ways to deliver healthcare, this discussion will explore the changing healthcare landscape and how entrepreneurs are leading the way to improve lives. 2020 showed us the importance of good health and also the glaring problems in the healthcare system. These entrepreneurs will discuss the issues they're solving and the innovations they are using to do so, along with the lessons they've been learning along the way. So Barbara, I'll let you introduce our panelists, but I want to introduce you to our audience. So Ms. Barbara Barnett is a lawyer with Stone Pigman and focuses her practice on corporate business and commercial real estate matters. She assists clients with a variety of transactions, including working with entrepreneurs, emerging companies, and investors through all stages of a company's life cycle, from formation and private placement through expansion. Prior to joining Stone Pigman in 2015, she practiced with 2 international law firms. She received her Master of Arts and PhD degrees from the University of Chicago and a JD with honors, congratulations, the George Washington University Law School. She is a member of Louisiana State Bar Association and the State Bar of California. Ms. Barnett is also a member of the American Political Science Association and the American Academy of Religion, and has served on the faculty of Elmhurst College and Loyola College, New Orleans. Barbara, thank you so much for joining us today, and I'll turn it over to you now.
Thanks for having me. Thanks, Wendy, and thanks to the Lexis team. I'm very excited to be able to be a part of BREW for its 10th anniversary and to be able to be a part of this panel. In my work with startups and emerging companies, I do work with a number of health tech companies. And so it's great to be a part of this conversation of how you all are innovating healthcare and healthcare delivery through the use of technology. So I do have notes that there's a couple of housekeeping matters that I'm supposed to mention. First, a reminder to all participants that this is a respectful place. And so please respect your other participants and their points of view and perspectives when engaging. But we do also want to encourage you to engage, use the chat feature. I'm able to see the chat feature. Oh, there's people chatting. So I will keep an eye on the chat feature. We're going to hold the last 15 minutes of this for Q&A, but I'll keep an eye on the chat feature. So if anybody, brings something up or has a question that's particularly germane to the conversation that we're having, I'll go ahead and loop that in. So I am going to introduce our amazing panelists. I'm very excited for y'all to get to know our 3 panelists today. So we have Charlotta Carter and her company, LENA, which I just learned stands for Learning to Love to Eat Nutritionally Always. So that's her platform for helping type 2 diabetics manage their diet and their needs. So I'll let Charlotta tell you more about her company, but she has 25 plus years in software development and staffing. She's the founder of LENA, which is a type 2 diabetic management platform to reduce cost and manage type 2 diabetes 24/7. She's CEO of GRA Technology Solutions, which is a software and staff augmentation company headquartered in the US and Canada. She has also held senior technology positions with companies that include IBM, Microsoft, Sun Microsystems, and SGI. She's on the board of directors of the Silicon Valley Leadership Group, the Minority Women Entrepreneur Organization. She's a member of the Goldman Sachs 10,000 Small Business Alumni Club. Not actual club, she's an alumni. She's an alumni. She's a member of the California Small Business Advisory Council, the Small Business Enterprise, and Small Business Majority member of How Women Lead, as well as National Association of Women Business Organizations. So welcome, Charlotta.
Thank you.
I'm also joined by Vishal Vasanji. And Vishal is the co-founder and CEO of Relief Telemed, which is a healthcare delivery platform. Vishal spent his early career working in finance, operations, and business development at a Fortune 500 company. He's a natural problem solver, and Vishal was able to identify gaps in the marketplace and develop solutions that are simple and scalable. As the co-founder of Relief, Vishal identified a need for patients to have access to affordable healthcare on demand and in their home. Today, Relief is one of the fastest growing healthcare startups in the region. And we also have Shelby Sanderford. Shelby is founder of DocPace, which is a virtual waiting room solution disrupting the traditional doctor's appointment process for both patients and medical staff. Driven by her desire to create system-wide change in the healthcare industry, Shelby is passionate about creating a world where healthcare is something everyone is able to prioritize. Her background is in applied psychology, health administration, and she has a master's in business administration. This combined with her natural love of problem solving and her desire to help others has led her to start DocPace. So welcome to each of you. I'm so excited to have you here today to tell us a little bit about your entrepreneurial journey and specifically your innovations in health tech. So I'm going to start. The first question that I have for each of you is to briefly tell us the problem that you're solving. So what's the problem and how have you innovated a way to address it? Charlotte, I'll start with you.
So my problem started with me. I was diagnosed with type 2 diabetes in 2017, and my whole family has diabetes. My grandmother died of it, my aunt died of it, my mom has it. And so I wanted to stop. My doctor told me I had it. I said, okay, fine. And it wasn't a surprise. It wasn't an if, it was when. So when I was diagnosed, and I was at the top of the level, I had my appointment, and we went from me having type 2 diabetes at the top of the level to me getting off of insulin in 6 months. And it was an endocrinology-led method that helped me do that. So I went to look for something that would help me continue that, and it wasn't there. So the ability, what it really was health and nutrition, exercise and coaching is the thing that really got me off of the insulin. So I went back, decided, I was going to do something about it. I traveled a lot. Eating healthy was not an option a lot of times because I didn't know what or where to eat. And so we built a prototype to really around that endocrinology method of health, nutrition, and coaching. And so we wanted to reduce the need or the cost. And insulin is expensive, metformin is expensive. A lot of this stuff, a lot of the solutions that are out there are pharma driven, and so it's made to keep you on drugs and keep you going that way. So I wanted to look at something that was easy, affordable, accessible for everybody that had type 2 diabetes.
Thank you. So Vishal, tell us about the problem that you've identified and how you're solving it.
Yeah, so we, my previous experience was in physician offices and practices, and so that was before digital health technology was widely available and easy to use. And so, I had personal passion of mine is just technology and how do you weave it into different organizations or different functions that we do. And so I always had an eye towards how do we combine technology and healthcare and make it more efficient, because we've always known that healthcare was the one industry that no one was happy when they said they had to go to the doctor's office. And so whether it was you just waste a lot of time at the doctor's office or you just don't get the answers that you're looking for. And so really this company was the genesis of probably 5 or 6 years of previous experience. And, just personal experience of having a family with 2 little kids, 2 working parents. When one of our children has to go to the doctor's office, it's an ordeal. We have to coordinate schedules. Mom has to take both kids to the doctor's office. And this was a story that resonates amongst a lot of people in the community. And so we said, how do we take the doctor's office and bring it to the patient? And so we looked at a lot of different business models and picked from the delivery companies, picked from the physician offices, picked from the digital health technology that was out there, and basically put them all into a pot, stirred it up, and said, here's Relief, which is essentially the doctor's office, except for now we can bring it to you into your house. And then the pandemic just put nitro into our business model, where no one could go to the doctor's office physically. And so people were constantly, asking us, hey, can you come to our house to get us COVID tested or do XYZ tests? And that's really where our company took off. And it's just been nonstop since then. So Really, the problem that we're solving is it's an age-old problem that people didn't realize they had, but the pandemic really brought it to the surface of, hey, we don't want to go to the doctor's office because one, it's really inconvenient, but two, we really don't want to be in a waiting room for a bunch of sick people. Because the saying is if you don't go in sick, you may come out being sick. And so that problem resonates with everybody that's interacted with the physician community or doctor's office community, and Relief is there to help solve that.
Great. So we're going to come back in a minute to how COVID has sort of changed everything for everyone, and particularly for your companies. But I want to bring Shelby into the conversation. And particularly, I saw you nodding, Shelby, when Vishal was talking about, people feel like it's a waste of time sitting around the waiting room, and they're like exposed to sick people. So Shelby, please tell us about the problem that you've identified and how your company solves it.
So we have, I know I'm just nodding away over here because we have wonderfully parallel stories here, both trying to really help solve similar problems, just taking different approaches. So it's fun to hear. I also started this company out of a personally experienced a pain point when I was working in hospital administration, and really was able to recognize how much patient satisfaction really is a pain point and impacts the bottom line for a lot of these organizations. And just after studying and diving deeper into it, realizing how much opportunity there is to improve wait times for doctor's appointments and having to sit in a waiting room, and can we implement a solution that actually reduces wait time and eliminates the need for waiting rooms. Now, it's really interesting because it's a pain point a lot of us have experienced, probably on the patient side. I think we're all pretty familiar with having to wait in a waiting room and what that experience is like. But where our approach is different is that we actually have taken a deeper dive into that and have realized that, interesting enough, the burden is actually even greater on the medical staff side and the folks that are running the front office. So while we're solving a pain point that's very familiar for patients, we're also implementing a solution that is actually helping a practice run their operations so that we can make the experience better for the medical staff and the front office staff as well. And I think that's something, important to acknowledge in solutions moving forward, is recognizing how they can help everyone involved in the experience. So our solution is a virtual waiting room. We've essentially eliminated the need for waiting rooms with the DocPace tool. So excited to share more of that as we continue the conversation.
So Shelby, how has the COVID-19 pandemic affected your plans for DocPace? Has it shifted your way of thinking about the DocPace tool?
I think it has. So, going into the pandemic, as it first started, it was really about figuring out, okay, well, how is this going to impact the market in the long term? And back when I started this company, I had a vision of, okay, we don't need to have waiting rooms anymore. We can have the in-person doctor experience and just be able to show up to the office at the time that the doctor's able to see you. There's ways that we can optimize that experience. And so I initially was envisioning where we could take the waiting room out of the scenario. And I think now what has happened is just kind of accelerated that vision and kind of pushed it further into motion, and that I think a lot more people are on board with, okay, we don't have to all sit in a waiting room to be able to see the doctor in person, and what are the solutions and tools we can implement to manage that experience now without a waiting room. So I think overall it's definitely propelled the mission into motion just further, just accelerated everything.
And Vishal, that was the point that you had made, that it really is all of a sudden the need for remote healthcare delivery was on fire. So is there more that you want to add to that?
Yeah, absolutely. I mean, there was always cracks in the healthcare foundation, and there was really nothing. There was no cataclysmic event to bring that to the surface like the pandemic. The pandemic, like I mentioned earlier, it exposed what everybody had already been talking about in the industry, what they had been preaching at conferences and talks, but no one did anything about it because there was no incentive to do anything about it. No one was forced to do anything about it. The pandemic literally said, "We are shutting your doors. You either figure it out or go out of business." And you figure out a way to get to your patients or go out of business. And so every doctor's office across the country had to adopt a digital solution, whether it's a service like mine, whether it's even if it's just regular old FaceTime, they had to adopt a digital solution. And so it really accelerated the adoption of digital health into 2021, really. And it's crazy to think that it took something like COVID-19 to do that, because in every other aspect of life, we do everything on our phone except for healthcare. And so if there's a silver lining to what 2020 did, 2020 brought the healthcare into 2020, literally. I think solutions like mine, solutions like Shelby's, solutions like Charlotta's, it's just the tip of the iceberg. I mean, I think over the course of the next 5 to 10 years, you're going to see this crazy roadmap of innovation coming out of all parts of the country, because now, anytime you put computer engineers or innovative people on a problem, they're going to come up with really cool, innovative solutions. And that's what you're about to see, the next wave. And I think we skipped healthcare 2.0 and went straight to healthcare 3.0 because
3.0. So Charlotte, I'd like to get you into the conversation about how COVID-19 affected your business. One thing that sort of occurs to me, there was a period of a few months where we were ordering our groceries online. We weren't going into grocery stores. And so I'm wondering if the food delivery feature of your product was something that was affected by this.
Yeah, when it first hit, we kind of like, oh no, what are we gonna do? We slow down, and it was like everybody has to eat, right?
Yeah.
And so, and it was even more difficult for diabetics to get the healthy food that they needed. So the ability to use Amazon, or the ability to order online, groceries from a restaurant or delivery, it became pretty apparent. And so the other thing we researched was the top 5 states that had that was affected by diabetes and COVID the most was Louisiana, Mississippi, Alabama, Arkansas, and West Virginia. And so, we definitely, started formulating our relationships, in those areas, especially, in Louisiana, because no matter what, I mean, people still have to eat. And so whether they couldn't go out, they couldn't go shopping, or if they did, the lines were long, and you're standing in line. So ordering online was an issue for some as well too, because even Instacart had sometimes days backlog, but that was the only way that people could get food. So we estimated our online commission percentage really low originally, and then we figured out, this is going to be the wave of the future. And so being able to get your food online within an hour or 2 hours to really calibrate what your blood sugar was coming into light. And we initially thought you had to build out your meals for a week or two, over time. But because the delivery services have really upped their delivery time frames, it really helped us with our customers being able to have the food that they needed almost on demand.
And I think one theme that I'm seeing that the sort of digital transformations that each of your companies is offering is being able to address issues related to healthcare in real time. That you're able to sort of, so for Charlotta, you get your measurements in the morning, and then what you can eat for breakfast. Like it's this sort of immediate solution in real time. So I'm wondering if this is something that is, as Vishal said, we're just late to the game. Everybody wants immediate answers for everything and immediate.
Yeah, every every VC meeting I go to or everyone I talk to, it's like when you make things easy for people, people are basically lazy. Let's just throw it out there. And so when you make life easy for them and you build the solution where they think, how did I ever live without this? You got a good solution. And then if you can say, if I can expand this for 1 billion users, you've got a really good solution. So easy to use. How did I ever live without this? Scalable to 1 billion people. It's very simplistic, but if you think in those terms of building a solution for people, starting locally, building out nationally, and then globally, you're really onto something when you can do that. And like I said, I took the idea of it worked for me. And the other thing is, like a lot of the competitors out there, it's a closed society. So like the Omadas and Livongos, you've got to be in a particular insurance group. You've got to work for a particular company. You got to have specific devices. With Lena, anybody can use this, and it's accessible to anybody anywhere. And that was what we were going for.
Mhm.
So scalability.
Barbara, you brought up a great point about how. Yeah, I mean, you brought up a great point about how people want stuff. Right? Yeah, you brought up a great point about how people want stuff right away, right? And funny story is we, over the fall semester, we were doing tests, we were providing services at a university, and our wait time to talk to a doctor was 3.2 minutes. And we were getting calls from people saying, hey, it's taking forever to connect with the doctor. The doctor's not answering my video call. And literally it's 3 minutes. And when you look in the grand scheme of things, 3 minutes doesn't sound like a lot, but if you look at it from a patient's perspective, to sit there for 3 minutes waiting for somebody, it seems like an eternity. And so the whole real time needs to happen now. It's infiltrating every part, because now you can open up your TV and watch any movie you want right away without waiting for it, right? Without waiting for it to come in theaters. You can, I want that thing off Amazon. It'll be in my doorstep tomorrow. I don't have to leave. So this whole idea that you don't have to go anywhere because everything can come to you right away, it's going to accelerate and compound. And companies, whether it's healthcare or not, that figure out a way to do it are the ones that are going to survive.
And I think, the other half of the convenience story is the transparency story. So, that's what we've seen happen in almost every industry now is we live in a very convenient world. We can have, just like you're saying, anything at the tap of a button. But the other piece of that is it's very convenient to access, but it's also very transparent of when we'll be able to have it in our hands. And I think that's the other really important piece of the story moving forward is that's what people are used to. That's what people are accustomed to in every other aspect of their life. And why does it have to be different when it comes to your health and your care, your personal care? And so, being able to know I have to wait 3 minutes to talk on the phone with the doctor will completely change the conversation of how that person feels about waiting 3 minutes versus, an unknown timeline. Like if you order food, exactly when it's going to be at your door. So you're like, okay, 15 minutes doesn't seem that bad because I know it's going to be in 15 minutes. And so, that's where I see there's a ton of opportunity and kind of where the healthcare industry is slightly behind all the other industries. And it's getting there though. It's going to catch up.
Well, honestly, I mean, if a solution had been out there already, I wouldn't have gone down this pathway because it's been brutal, right? But in learning, and I didn't really know how many diabetics there were out there. I just, I was frustrated because I couldn't find something to help me manage this. And when we started doing the research, 100 million people in North America, almost 500 million worldwide. And then this leads into cardiovascular, which is another 1 billion people. So we had no clue. none whatsoever, that the problem was this widespread. But like, seriously, I mean, I talked to my doctor. I downloaded probably 5 or 6 options, and none of them. They would all tell me, "Oh, your blood sugar is this. Have you eaten today? What have you done today? What can you do today?" And I was like, I don't want you asking me questions. I mean, if my blood sugar is this, tell me what I can be eating and where I can find it and what I need to do next. And that was a part that was, really frustrating, because you were giving me the obvious, and giving me the obvious is not helping me. I mean, I can get my blood sugar from one touch. I can get it from any number of these machines that are out there. But how do I manage this? How do I manage this from day to day? How do I manage it 24 hours? What do I do? What do I do to to keep it steady, and those types of things? And those were the things that I got in the 6 months that I worked with Dr. Zhao. And that's exactly how we built this. It's like, it was built on, this is what you need to do, this is what you need to eat, here are your numbers, this is what and so we built it on that simplistic. We made it, I mean, the algorithm is complex, of course, and it's all, the AI part of it is personalized, because what it does over time is it learns what triggers your highs and lows, and we won't recommend that to you as time goes on. But I mean, it's very complicated, but we built it off of a simplistic thought of, managing this and getting me off of the insulin. So that's why we're here. Like, otherwise it's been brutal.
Yeah. Yeah. Well, we're right. That's the entrepreneurial vision is how do I fix this, right?
Yeah.
So what have been some of the greatest challenges in your entrepreneurial journey, and how have you managed to figure out how to overcome those challenges?
I could write a book. I have one right now. I'm sitting at home working, and my dog is scratching at the door. It's I mean, our biggest challenge, I think any entrepreneur, right? Whether it's healthcare or anybody, it's when you start off, you get a lot of no's. You get a lot of no's from people that think your idea is crazy. You get a lot of no's from investors. You get a lot of no's from clients. You get a lot of, hey, your idea is great, but, and I think where people fall or people stop or give up is they don't keep the mission moving forward, right? So you have to have a lot of belief in yourself. You have to have a lot of belief in the people you surrounded yourself with during this journey, because and my co-founder will tell you, I have called in the morning completely down in dumps, saying, what are we doing? We don't have any money in the bank. How are we going to do this? And then by noon, I'm like, all systems go, running on nitro, like we have the best idea in the world. That is mental exhaustion. And so to have a support system around you is very crucial, because you're going to get knocked down, you're going to get pushed back, you're going to get pushed to the side a lot. And just to keep moving forward is probably the biggest challenge you have as an entrepreneur. And the way you overcome it is by having people in your corner that are going to push you and support you, but also having that own inner belief that what I'm doing truly is something that is going to be successful, and keeping the fight alive is probably the biggest obstacle that I face every day, even after somewhat getting off the ground.
Michelle, I think you should put that as part of, we should all get together and build a startup packet. And we're seriously put that in, because one of the other things that was really difficult for us was actually getting the prototype done. It's like, how do you do that? Where do you find the resources to do that? We had them, but they were on other jobs. But just getting started on proof of concept, was tough for us. And then we got that part done and did all the testing and everything. It was like, well, how do we do our projections? The pro forma was like, I don't know what I'm doing here on the pro forma. So we had to call somebody in to help us with that. And then, you're doing your pro forma based on a bunch of numbers, and then your VCs, oh, this is unrealistic. Like, well, you're not looking at it the way we're looking at it. So the pro forma was another piece of ours that, we found very challenging, but we ended up finding a guy that we actually brought on board as an advisor. And so he kind of helped us through that whole part of it. But I agree with you that we should all get together and put up a startup kit the do's and don'ts and sell it so we can all take part to fund our own startups. I think that would be fabulous because
It sounds like a fabulous idea. You heard it first here.
Yeah, I'm actually trying to get my guy that built the Proformer for me. It's very complex on the back end. And if he puts a dashboard on the front, it would be killer. Because you can put in any industry that you want, you know, whether you have click-throughs, whether you have deliveries, whatever you want, but it's too complicated. And if you put a dashboard on top of it and sell that Proformer to startups, I'm like, Craig, you could make a bet. Because, I don't have the time. So, but yeah, you know, something like that most startups are dying for, because you really need that to build when you're building your pitch deck and you're doing your, you know, your adjustments. So those are some of the things that were challenging for us.
Absolutely. So Shelby, do you want to share your biggest challenges in your entrepreneurial journey?
Yeah, absolutely, because there's definitely not a lack of them. So I think you both have made some really wonderful points that I just kind of wanted to add and build on to, because you do get told no a lot during this process. And for me, one of the things that has been really helpful with that is, you know, a lot of times when you get told no, it's something that's out of your control, right? And I think moving forward, you have to stay really focused on what are all the things that are in your control. And if you stay more focused on those things, then, you know, you can feel more confident in the next step and the next step, and just kind of keep building on that. And I think the other thing that's important to note there is that it really has to be something that you are personally passionate about. Because at the end of the day, you know, having to continuously keep overcoming those challenges, it's like what really is motivating you is because it's really in your heart and something you care about and want to help resolve and make a difference about. And, you know, the other really interesting point that was brought up is having a simple solution. So a lot of what we're doing is, especially in today's world with the amount of technology and AI and everything that's going into these technology solutions, is very fancy and confusing and hard to explain. And so it's like taking that and really simplifying it and making it something that is user friendly from every aspect. And I think that's been another one of our big challenges, is like, how do we take this very complicated product and make it something that is super seamless and easy to use, and that just kind of fits into everyone's day and really is visible. You know, the value it's adding is really something visible for all the parties involved. So for us in particular, we have a solution that helps not only providers, but really front office staff, and at the end of the day, patients. And so kind of bringing that full circle and making that visible to everyone has been a really interesting challenge. I think those are my main takeaways from that to build on y'all's points.
She brings up a great point in the simplicity, right? So healthcare is very complicated. It's
so complicated.
Barbara, as an attorney, you understand how all the complexities that go into the regulations and the compliance and all the,
yeah, I do have a question on that.
To make sure you don't end up in an orange jumpsuit. You know, it's a very complex, and it's not an easy to explain industry. And so the challenge, and we still struggle with this today, is how do we take, like Shelby said, something that is very complex, right? If you open the hood, there's a lot of gears and a lot of things turning. But when you close the hood, you got to be able to say, here's what we do in 30 seconds. And so that's been our biggest challenge. And even 3 years in, we're still, while we've defined who we are and what we do, we're constantly looking for ways to how do we even cut a 30 seconds down to 15 seconds on what we do. And because that's what people want. Like Shelby said, people want simple. They don't want to have to think about what it is your product does. They just want to be like, oh, that's what your product does. And so that's a challenge, I think, just for any entrepreneur, but especially in healthcare where it's so complicated. And there's a lot that goes on behind the scenes that people don't know about. You know, for them, it's just, hey, I saw the doctor and I got a prescription.
Yeah, so thank you, Vishal, for mentioning the complex regulatory landscape and all the minefields that you need to work through when you're in the health tech space. So because it is so heavily regulated, and that also means that startup costs can be very high, because you do need to make sure that you're not stepping on a landmine. You do need to make sure that you've explored what are the legal risks, what are the regulations that apply, and making sure, so for example, with HIPAA and high tech, that you can afford to bring on a service that's able to deliver that compliance for you. So what is your advice for entrepreneurs who are looking to get into the health tech space, given this sort of high barrier to entry?
I mean, I'll give you a great example. So during the pandemic, March, April, May timeframe, the CDC, the FDA had put out guidance that at-home testing was not allowed. And so that's what we did. We did at-home testing. So we literally had to challenge. We reached out to our senators and a congressman and said, the definition of at home is misdefined when it pertains to us, because the only thing at home about us is that we are at your house, because we have a nurse at your house, we have a healthcare professional at your house, whereas the FDA classified at home as you, the patient, taking the test by yourself and mailing it in. That was not approved back then, right? So we literally we incurred, a substantial amount of legal expenses to get an opinion to say, and finally we got approval to get it done so that we could do it. But look, it's not going to be cheap, because to get into healthcare, you do have to explore your regulatory boundaries and what you can and can't do. Mm-hmm. But to that extent, because there are so many regulations that are archaic, you have to be super creative to kind of, I don't like to use the word get around it, but really stay within the confines of that, but still be innovative. That's a huge challenge for healthcare entrepreneurs. Is there's so many archaic rules and regulations that stifle innovation, that you really have to start trying to say, okay, here's the rule that I got to work within. How do I conform that to what I do? You're going to spend money doing it, that's for sure, because like I said, you don't want to end up in an orange jumpsuit because of something that you tried to skirt a rule or regulation.
Mm-hmm. We got really lucky. We were part of the Small Business Development Center in Southern California, and we got accepted into what's called Legal Startup Garage. So a lot of our legal work was done we got probably $50,000-$60,000 worth of free legal services for 9 months. I don't know if that's available to everybody, but that's an option. And then the other piece of what we do is we don't take any DNA or anything like that. So all of the information that's provided to us is provided by third-party devices, either One Touch or if you have a Bluetooth. So those are the devices that have to be FDA approved. We're not, taking anybody's, we're not taking anybody's DNA. And so the information that, we work off of is information that, the customer provides to us in our system. So if you're telling us that this is your number, or that's your number, then this is what you're going to get as a recommendation. The other thing that we, and we got legal guidance on this as well too, a lot of restaurants, you can't really know what they're putting in a lot of the food. What we did have them do is to do a disclaimer for us that covers that, because we will give you the baseline values of what that food should have, but we don't know if that chef put a ton of salt, or if they put a ton of sugar, if they ladled it, if they deep fried it or whatever and made it, soggy, whatever. So those are the things that's out of our control. But for the baselines of the foods that we're recommending from these restaurants, if it's a chicken salad in our glycemic index based database, we can give you the value for that. If that person deep fries the chicken and throws a whole bunch of sauce on top of it, that it's outside of our ability to be able to predict that. So those are just some of the things that the hurdles that we've had to jump over.
Yeah.
I'll jump in and add, for us, one of the biggest hurdles was finding the right contact and the right legal advice and expert to talk to in this space of, how to how to build the right product in this space. And I think one of the things that was the most valuable for me personally was really networking and connecting with the folks that I did know in this space to see who they also knew and see who could connect me to the right folks to help at least go down the right path. And that was incredibly beneficial for us. And it took a lot of networking. Like I had to talk to a lot of different people to get to the right person. But I think that was a great beneficial thing for us to do.
So that's a
Especially in
perfect time.
Louisiana, because yeah, especially in Louisiana, I mean, you go to Silicon Valley, you can throw a rock and you'll find health tech experts, whether they're legal, financial, whatever they are, right? Whereas in Louisiana, you really got to dig deep, and you really got to talk to people. I mean, they're there. I mean, we have a great attorney that understands the health tech space, and really bought into our platform. That was the other thing. The attorney we had to convince the attorney that what we were doing was innovative. And once he bought in, he was all in, right? But it's different in Austin or New York or LA or San Francisco. Like throw a rock and boom, you got a health tech attorney that's probably done hundreds of $1 million of health tech deals. Whereas here, you really got to work to find that right person that is aligned with your company and is going to help you, because those legal bills can rack up if that person that you're working with, or financial bills can rack up if they don't understand what you're doing. So, like Shelby said, you got to network and find the right person that can help you.
I actually network across the nation. So all over, we knew that, we could get support resources where we're headquartered in San Mateo originally, but Nexus, Louisiana was close to Southern University where I went to school. And that's kind of ground zero for diabetic and food insecurity and food deserts. So, we looked at that and said, this is where our customer base should start. And, we can get it working here and make it work. It should be easy enough to grow, outside of that. So we haven't boxed ourselves into, to resources in one location. And I mean, I do have the luxury of having Silicon Valley connections. We have connections in New York as well. And then having grown up in, Louisiana, I mean, I went to Southern University myself. I grew up there in Baton Rouge. And so I'm really connected to that community as well. So we kind of let our canvas be North America. So, because we also have connections in Canada. So I just open your networks and reach out. And if I have connections somewhere that you guys might be able to use, please feel free to reach out.
Yeah, so networking. It's a perfect opportunity for me to plug the lounge and the one-on-one networking and the BREW platform. So take advantage of the networking opportunities available to you through the BREW platform. I also, Charlotta, you mentioned something. You mentioned, food deserts and healthcare deserts, and there was a little side conversation happening in the chat about digital deserts and about how, we were talking earlier about, healthcare services and healthcare needs being met on demand. And there's a huge swath of the population that's potentially being left out of these opportunities. So I wonder if each of you want to say a couple words about, how you think about this problem of expanding access to good healthcare for the future.
Well, we are working with Southern University Ag Center on just that problem. So we're looking at incubators. We're looking at food desert and how we do that, and using Lena as the interface to the community. So we use it we're trying to build an entire ecosystem that would give them access to fresh foods and foods that are nutritiously balanced by the incubator. And we're working with Dr. Fatima from Southern University on some of these. So we're already kind of knee deep into some projects working with them. One of the things I think, right now, most people do have access to internet, but one of the things that are hindering some of the movement into some of the, underserved areas will be access to internet. So we're hoping in the next administration, there would be some focus on expanding Wi-Fi and those types of things so that they would have access Lena, which will give them access to the food sources that they need, whether it comes from the incubator, whether it comes directly from our farmers, whether it comes from, Amazon, whether it comes from a restaurant, and we build an ecosystem around delivery there. Those are some of the things that we're already working on.
Yeah, we're working with the payers of those communities, the insurance companies that serve those communities. Our application is smartphone based. Lucky for us, there are tons of cheap smartphones that are out there that people now use today. And as a matter of fact, I think even the free government phones are smartphones now. But the technology cost has come down so much that it makes sense for some of these insurance companies to provide that technology to their members so that they can access services like ours that ultimately do save the insurance companies money. So, we've gotten a lot of requests from people in small town Louisiana about, hey, how do we want to use your service. Right now, we're not in those communities, but we're working with those insurance companies and the people that serve those communities to say, hey, here's how we can ultimately save you money. And so therefore, all you got to do is buy a little $50 smartphone for your member, and they can get these services. And oh, by the way, there's other services that they could use. So it's really about kind of working backwards, and instead of marketing directly to the members, you market to the insurance companies that serve those members and to help them. So, but yeah, like Charlotta said, I think there's money coming out at the federal level. There's a bunch of telehealth money that got given to hospitals to buy equipment, to buy phones, to buy devices to put into patients' hands, because that's just where healthcare is moving. Again, the pandemic, just like it did in the educational world, where not every student had a laptop, right, to do virtual learning, it exposed that not every member has access to the internet to get video health technology. And so I think there's stuff going to be coming out over the next few years that'll help bridge that gap. But right now we're going to the payers and saying, we can save you money. And so therefore, why don't you take some of those savings and buy the equipment for the members? So, we're working on stuff like that to help those people out in those communities.
You also mentioned something about kiosks in the chat. Do you want to say more about that?
Yeah, so we're working behind the scenes right now to set up to create community type kiosks where we could put them in maybe pharmacies or community centers, health centers where people can get together in communities like that, so that they can go to the device, tap a screen, talk to one of our doctors, and one of the nurses can meet them there or meet them at another location. But it's just about bringing more points of access into those communities, because there's already a deficit of providers in those communities. And so through technology, we can extend a doctor into that community that physically is not located there. So the technology is already out there. We're trying to make it work for us and bring it to some underserved communities. But kiosks, I think you're going to start seeing kiosks in office buildings, community health centers, pharmacies, anywhere where it's convenient for a patient to come in and talk to a doctor. I think you're going to start seeing stuff like that.
Shelby, did you have anything to add to the conversation on that?
Yeah, I think it opens the door to another really great conversation. Is really part of the story of access is also really understanding the needs of the patient. So, if we're looking at any other business, one of the key indicators of success is to really understand the needs of your customer, right? And so I think now we can shift that story. And if you can really understand the need of the patient and kind of focus more on that value experience that's customized to a patient, you can understand how to meet them where they are. And I think that's, another place where there's huge opportunity in healthcare right now is to kind of shift the story a little of like, how can we better understand the needs of our patient base and really meet them where they are.
Yeah, absolutely. Absolutely. All right. So I'm behind schedule. We have 8 minutes left. So I'm going to look at the chat and see if there's, additional questions from our participants. And then I have a wrap-up question for each of you. So, people love the idea of a startup packet for Louisiana entrepreneurs.
I think another great point in healthcare is a lot of employers are now starting to take it into their own hands, and realizing that by keeping their employees healthy, and
It's good
productive,
for the bottom line.
yeah, it can help their bottom line, right? And so for a lot of these underserved communities, if they're working individuals, then sometimes they can get those services through the employer. So I think people are now more invested in health of the workforce, whether it's paid for by the employee or the employer or the insurer. You're going to start seeing a lot more companies. We've seen a lot more companies reaching out to us that would have never called us about providing services to their employees, but now they realize that if I have 2 employees out of sickness, the issues that it causes on the back end. Maybe before they didn't realize it, now they get it.
Right.
So, now if you have a runny nose, you're advised to stay home. So it's something that the employers have to deal with. It's real. Exactly.
So another comment that came up in the chat has to do with the fact that all healthcare needs cannot be served digitally. So, MRI machines are going to have, you don't have a portable, although there is a prototype for a portable MRI machine, but the MRI machines are big, heavy instruments. And so, you aren't talking about eliminating the need for physical brick and mortar healthcare systems. You're going to have an MRI, a radiology lab that you go to for an MRI or a CAT scan. There's still going to be operating rooms where you're not going to have surgery in your home. But so what are some of the things that we think of today as being, absolutely necessary to have in a brick and mortar setting that maybe 15 years from now we'll think, well, that was just a not necessary at all. What do you guys think about that?
Yeah, I mean, it's very similar to what retail is going through now, right? So if you look at what everyone thought Amazon was going to create this whole industry that all these stores were going to be gone, right? But in reality, what happens is not everything can be served digitally. And so the companies that survive are the ones that figure out a way to bridge the gap between brick and mortar and digital. So Best Buy, Target, Walmart, they have a great digital presence. You can buy stuff online, but there's just some things that you can't buy online. Like very rarely do I buy clothes online because I need to try it on, right? I may purchase it and then go to the store, try it on and just leave it there if it doesn't fit me. But there are things that have to be done physically in space. So a company like ours, we're not trying to eliminate the doctor's offices, right? We understand there's a place for them and not everything can be done at home. You can't get stitched up, or if you have a broken leg, you can't get fixed at home. And so the idea is how do you create solutions that bridge the gap between the physical space and the digital space, right? Because there is, like, you're right, you can't have surgery at home. You can't have surgery in the back of an ambulance. So, but you can do the follow-up digitally. You don't have to go to the doctor to do a follow-up. You can do your pre-op digitally. You don't have to go to the doctor just to give your blood. Somebody can come to your house, take your blood, and send it off. So that's how you mirror, that's how you combine the physical space with the digital space and bridge the two together. And so solutions that figure out how to do that, and companies and healthcare institutions that figure out how to do that are the ones that are going to survive going forward. Because you're right, you're not going to eliminate the hospital, but you can make the hospital more efficient.
Well, one thing I think of, Barbara, is that what we are moving into, I think, which is a good thing, is more preventative care. And so a lot of on the back end, the need to, to have all, to go to the hospital and all this other stuff, you start to bring the cost of healthcare down. So I think the really good part of it that people are not realizing the offshoot of it is all of those things that we go to the doctor for anyway will start to reduce that. That's reducing the cost of healthcare for taxpayers. So, and for insurance companies. So it's a really good thing that, I mean, I still have to get my eyes checked. I'll have to go in, every 3 months or 4 months or whatever. But for the most part, because, I collect 30, 60, 90 days of my blood sugar readings and things like that, I can share that with my doctor online. And it really eliminates, the time and the need, to have to do that. So it's bringing the cost down.
Yeah, so I think you just made a great point there. Like the common resource that we all have the same amount of is time, right? And so figuring out how to optimize each person's time. And I think a lot of that has to do with figuring out, there's a fine balance of what can be done virtually and what can be done in person. And you can figure out ways to optimize both. So, weeding out what can be done virtually so that we can actually open up time for what needs to be done in person. So there are ways that we can now optimize workflows and schedules so that you're really taking into consideration and valuing everyone's time.
Yeah. Okay. So lightning round. I got 2 minutes. So I'll give you each a little bit over 30 seconds to answer the following question. So I'm going to simplify it. What's your number one goal for 2021, and what resources do you need to achieve that goal? Shelby, you go first.
So our goal is really to be able to help as many people as we possibly can this year. We do integrate into scheduling systems, so we're very focused on that's kind of our target market is based on which scheduling system practices are using. And so to be able to integrate into more of those systems, which is just going to be us building traction and growing as a company. But we've got big goals, exciting year ahead of us.
So to achieve that goal, do you need,
yeah.
I'm sorry for interrupting. So to achieve that goal, what do you need? Do you need contacts with doctors' offices? What's the ask? So for people listening, what's your ask for today?
Contacts with doctors' offices is top right now, definitely.
So Vishal, your number one goal for 2021, and what resources do you need to achieve it?
Yeah, our top goal is to expand our user base. So the number of people that have downloaded our application, we want to double it for 2021. And to get there, we need people to download the app. So everybody that is tuned in needs to go download the app, and then tell 10 people to go download the app. But no, we need marketing support, and really just a lot of word of mouth and getting people to use the software, because we're convinced once you use it one time, you'll never go back. And so we just need people to try it once, because it's definitely unique what we offer. It's not something that's in the marketplace. So really just education, marketing, get in front of people, and just get as many people to use our service as possible, because it'll just grow from there.
Charlotta?
And same thing.
So I need downloads. Everybody download the app.
Downloads.
I segue on Vishal is expand customer base, helping with our marketing and branding. We want to add new vendors that have more certified diabetic friendly foods. So we want to grow our base, do more marketing, and add more vendors to our database.
Great.
What do we need? Partnerships and marketing support.
So you need marketing support. Okay, so Wendy's back to see us all off. Well, I just want to, before Wendy says goodbye, I just want to thank each of you for a wonderful conversation. It was so great to get to know you and get to know about your businesses and your solutions that you're bringing to modern healthcare. So thank you so much for your time. Appreciate the conversation.
Cheers.
Thank you so much, Barbara, and thank you for all of our panelists. I appreciate you spending so much time with us today and sharing your expertise and your story. I also want to take a moment again to thank our sponsors. Thank you, of course, to Lucid, our presenting sponsor, as well as Stone Pigment, which that is a name that should be familiar, because that is where Barbara is from. They're one of our major sponsors and a longtime supporter of our work. Barbara and our colleagues at Stone Pigment have been staunch advocates for supporting entrepreneurship in Baton Rouge and Louisiana for years, and we are honored to have them as supporters. So our next session is going to be our lightning talk session. And for you to get to the next session, the way this platform works is you will exit this meeting, go back to the agenda, and then if you've registered for the session, you'll be able to launch it once the session starts. Or if you've not registered, be sure to click register and it'll add to your agenda for the day. Be sure to take advantage of our one-to-one meetings. Don't forget that those are set by browsing other people's profiles, and then you will set up the meeting through that interface. And when it's scheduled, then you'll head over to the one-to-one meeting section of the event platform. You'll see it there on that little strip of icons, and that's where your session will be held at your scheduled time. And don't forget, High Stakes Pitch is Thursday night as a live stream, and there's still a limited supply of tickets available to attend in person, as is there a limited supply of tickets for our Improv for Executives session.